NK cell precursor acute leukemia (MNKPL). Because of its rarity, there is no consensus on the specific characteristics needed to clinically identify this disease. In a recent article published by Tokyo Medical and Dental University used various approaches to better assess the molecular profile and drug sensitivity characteristics of MNKPL. MNKPL was only the first proposed as leukemia subtype in 1997. Extramedullary involvement is one of the hallmarks of MNKPL. It is prevalent in East Asian countries. Although the immunological phenotype of MNKPL was explored previously, a full genetic characterization of the cancer type had not been performed. These details would help you support more accurate diagnosis of patient, which would lead to more appropriate therapeutic decisions. Therefore, the